I have no idea why it attacks young, healthy people.
He said it was the worst sore throat of his life.
And they kept saying, oh, any minute now, she'll wake up.
At that point, he started to convulse pretty violently.
It literally is a 1 in a million thing.
He was fighting for his life.
Hello, and welcome to Something's Killing Me. I'm B.D. Wong. Florida college student Lindsay Lemierre and Michigan EMT Kevin Nesbitt are both young, active, and healthy, until one day when each comes down with a sore throat. What looks like a simple case of the common cold soon becomes a matter of life or death. Their doctors know they're in jeopardy, but they don't know why. Could the key to their survival be in a forgotten disease and a cure hiding in plain sight?
Kevin was 27, very healthy. He's always exercised. He's, eats well. He's a very athletic type person.
Kev started feeling uncomfortable, started with a sore throat on Friday.
He's first responder to a lot of what most people would consider traumatic medical emergencies. He does get exposed a lot when he's out in the truck to all kinds of things.
He often has patients that are very, very ill or maybe leaving the hospital to have ongoing care.
So who knows if that had any bearing on what happened.
He was concerned because he doesn't get sick very often, so the fact that he was to the point where he felt that he needed to go in, because especially as healthcare professionals, we don't go in. We don't do that.
Monday, he went to urgent care. He had kind of a tonsillitis and just felt crummy. They pretty much just said that it was a virus and he should go home and rest.
When he first called us, we thought, as it was with a lot of kids, it was some kind of a strep throat. It was that time of year. It was, what we would have expected.
They just took a strep test and a mono test, and all those tested negative. I got a call from Kevin, and he was very distressed. And I could hear the pain in his voice, and he was describing full body pains. He just felt like he'd been told he wasn't that sick, and so he was struggling with himself about whether he was sick enough to warrant a trip to the emergency room.
You better actually be dying if you're going to the ER, because we see so much abuse that we don't go to the ER unless it's critical.
He would not normally ask for that kind of stuff, and we're 3 hours away from Grand Rapids.
So knowing that it sounded pretty urgent, I called his older brother, Christopher.
So I drive over there. He basically dragged himself out of the house. He had a towel around his neck. There was very little color in his face. Looked terrible, but you could tell he was sticking it out, obviously. It was a very quiet, somewhat tense drive, not knowing what's going on and not wanting to get him feeling worse by having to talk it out. And we finally get there and pull up to the emergency room door and kind of flag down the security guard and said he needs help. He was at the triage counter and he basically just collapsed. He started to convulse pretty violently.
And across the country, 21-year-old Lindsay Lemierre, a junior at the University of Central Florida, had been fighting a cold and sore throat that wouldn't go away. Her biggest worry was that this seemingly minor illness would get in the way of a trip planned for spring break.
New York City is her favorite city, and some sorority sisters decided they were going to go on a trip for spring break, and we decided to surprise her for her 21st birthday with tickets. I believe it was a week and a half before it was time for her trip. She called and said that she was under the weather.
She wasn't feeling well, so we made her stay home and get some bed rest before they were leaving.
It sounded to me like a common cold, nothing that she hadn't experienced before. You know, sore throat, runny nose, coughing.
She kept saying that she didn't feel good and she was feeling weak, and she went to the clinic at UCF to see if they could get her on some antibiotics. We knew she was sick, but we didn't know how sick she was.
The doctor there told her that she would be fine to travel.
When she got to New York, I remember her like still not feeling well. We did notice like she wasn't her normal like bubbly self, but it didn't seem that bad. Later that day, I asked her like, have you eaten anything? I think that's kind of when I started to really take a note of like, okay, you're not eating, you're not participating, you're really tired now, you really are starting to look really sick and feel really sick. We didn't want to leave her alone, but she was still like, no, like, I'm fine. I just want to rest.
I could tell in her voice that something needed to be done. She was telling me that it was hard to breathe, that when she took a breath, it was like knives were stabbing. That's when I said, you're going to have to go to the hospital.
I was at the fire department working, and she had texted me that she had called 911. I kept trying to call her back, and she wouldn't answer. And when she finally texted me back, she said she can't answer the phone because she can't talk because she can't breathe.
Lindsay's dad called and he was like, where are you guys? Lindsay's in the hospital.
They took her to an ER.
So we all went immediately to the ER where Lindsay was. They made her go to the bathroom, and I remember they came back with her pee, and it was like brown. Like it was just absolutely discolored. And we locked eyes and we were like, this is serious.
She was so dehydrated that she had gone into some kidney failure. She was also having some abnormalities in her liver function. She had an elevated white blood cell count, which is a sign of infection.
When they did the chest x-ray at the first hospital, they realized that there was a lot of fluid in her pleural space, right between the lungs and the chest cavity.
Even if doctors find fluid in the lungs, that doesn't necessarily say where the infection's coming from.
I remember one doctor saying, there's an infection somewhere, and like, it's a big deal. But nobody was talking about like what it is, where it is, what it could be.
And even though the doctors were checking all the right labs and running all the right tests, what they didn't know is that they would be up against an extremely rare and deadly infection.
They realized that that wasn't the hospital that was going to provide her with the best service, so they transferred her over to Lenox Hill. We made the tough decision to just start driving.
We just packed a bag and took off.
No one knows what's going on. No one's really telling us because we're not Lindsay's family, and we don't really have the rights to know a lot of what's happening.
At that time, I remember them saying something about maybe appendicitis. When we decided to leave Florida to go to New York, that's what we were thinking we were up against.
Well, probably about South Carolina, we talked to the doctor, and he told us that she was going to have to be intubated. They're going to have to put a tube in her throat to breathe for her.
I was nervous, just wanting to know more information. If you have to get intubated, that means that your lungs are no longer able to breathe on their own.
I was a paramedic, and I understood the medical verbiage. It definitely means you're really sick at that point.
Nothing can prepare you when you walk in and see your child like that.
"27-year-old Kevin Nesbitt had gone to the emergency room at Metro Health Hospital in Grand Rapids, Michigan, complaining of severe pain throughout his body. Moments after arriving, he collapsed.
Kevin had gone into septic shock.
Septic shock is when you have a low blood pressure due to an overwhelming infection.
Sepsis is a serious life-threatening condition. Every organ system can be affected by that. The heart starts to beat very fast, the blood pressure drops, and this is when some complications can happen, life-threatening complications.
That can kill you if it drops far enough down.
It really is a race against time. When a patient has a very low blood pressure, doctors have to act quickly to protect the vital organs. And they can raise the blood pressure by using an IV to give patients fluids and other medications.
I remember at one point there were like 3 IVs running, and they just kept hooking more up and hooking more up to try and pump fluid into him because he was so dehydrated at the time. What they ended up having to do was insert a very large gauge and a wire into your jugular vein.
They ended up going through his neck and ended up putting kind of like a bigger IV, and they put it more centrally, so it went straight to his heart so that the medication could get in quicker.
That was the height of my concern.
At that point, his brother, Christopher, called me, and we started down for Grand Rapids. We knew that it was perhaps more serious than we had, initially thought.
It was a lot of questions at that point, asking where he's been, what he's done, like what he'd been exposed to. They were taking blood and doing cultures and everything that they should be doing, but still no answers at that point.
We walked in and they started moving him up to the ICU, and we were told in passing that he had pneumonia.
Initially, the group of symptoms Kevin presented with were consistent with a common pneumonia, and these types of symptoms can happen from loss of viral infections or bacterial infections, or sometimes a combination of both.
The scariest part was when we walked in and she was already intubated and in a coma, and just like there on the bed. 3 hours ago we were talking to her. It was so terrifying.
We are rushed to floor 7, knowing that she was already intubated, but nothing can prepare you when you walk in and see your child like that.
I've intubated hundreds of people throughout my career, but it definitely wasn't nothing that a dad would want to see.
The sounds of the machines, I think, were the worst. Hearing the ventilator, breathing for your child. There were 6 or 7 bags of fluids on IVs, just knowing that everything that was there in that room was helping your child live. And without it, we wouldn't have her.
They asked about what she had been eating. They asked where she had been, who had she been with, if there was anything new that she had tried, and we had answers to all of it, and it still felt like there was like nothing being answered.
They were assuming it was some type of bacteria or virus. So they were just running all types of tests to see.
They were basically telling us that they didn't know what she had. They just knew it was bad. They knew it was something different, and that they were growing cultures to try to figure out what it is that was going on. And that they'd been doing constant blood work and taking the cultures to the lab, and they were waiting for the results to come back so that they could start treating it.
We didn't know what the organism was at that time, and so we treated her with broad-spectrum antibiotics that covered a number of classes of organisms.
There was a lot of heartache, a lot of worry. I thought we might not be bringing her home.
She was presenting in shock with multiple organ system failure. We did not know that she was going to survive.
They kept coming in and asking us if she had been splunking, if she had been in a cave.
How is being in a cave related to her lungs?
Two healthy young people were stricken with a mysterious infection. In Michigan, 27-year-old Kevin Nesbitt was admitted to the ICU after having violent convulsions in the ER. And in New York, 21-year-old Lindsay Lemierre was put into a medically induced coma in a desperate attempt to save her life.
She had pleural effusions. She had fluid around her lung, but that was infected fluid. She was in septic shock. She was in respiratory failure.
Her kidneys actually shut down, so she wasn't able to relieve any urine, and so the toxicity level started setting up.
The reason we had to sedate her to the point of coma was that her lung disease was so severe when she came in, and she was having so much trouble breathing that even when we put her on the respirator so the machine could do the work of breathing for her, she still felt very, very air hungry and was very out of synchrony with the machine and was fighting the machine.
If a patient is in shock, doctors have two very critical goals. The first one is to protect the vital organs, the heart, the lung, the brain, while also trying to find the root cause.
We were looking for what was this source of infection, this source of sepsis that was making her so ill.
They kept coming in and asking us if she had been splunking, if she had been in a cave.
How is being in a cave related to her lungs?
If doctors are trying to find the cause of infectious disease, they'll ask a lot of questions about environmental exposure. One example being caves. People that go spelunking or exploring in caves are at risk for certain bacterial infections, fungal disease, even rabies.
The concept there is we're looking for something other than the usual bread and butter, community-acquired pneumonia that somebody would come in with. You would not expect a young, healthy person to have come in with that kind of severity of illness.
I think the second day that she had been in a coma, I had to go back to Florida and just kind of keep in contact with Jimmy and Kathleen to hopefully stay updated and see what was happening.
It was kind of a weird just waiting game because we were all kind of helpless. There was nothing any of us could do.
By day 3, by 4, by 5, it was like, oh, Lindsay's still not awake. Is she going to wake up? There was that tiny voice in the back of my head like, okay, but what if?
The same mysterious illness that had made breathing so difficult for Lindsay Meier and had doctors put her in a medically induced coma was also causing Kevin Nesbitt to struggle for air.
Kevin was having almost daily CAT scans done, and they were monitoring how this fluid or this whatever was happening in his lung was expanding.
It was only until the next day when we looked at his CT of his lung when we saw the pockets of infection.
And so they needed to drain some of that off. He was getting very, very uncomfortable by this point. His lung had expanded so much that it was sitting on his diaphragm, and it had actually dislocated one of his ribs.
The lung abscess was certainly the biggest hurdle in front of us immediately. If you don't get that taken care of, it's just gonna get worse. And we're talking hours worse, we're not talking days or weeks worse.
A lung abscess can be really dangerous because if it goes untreated, more of the lung will be damaged, patients can go into respiratory failure, and the infection can spread.
You're uncertain as to how much further it's going to go, how much worse it's going to get.
We were on that minute-by-minute watch. Her kidney functions were coming back. They were able to dial down the ventilator. So then they said, we're thinking we'll take her off the medication that's putting her in the medically induced coma.
It's very important to try to take patients off sedation so that you're able to assess that they're getting better and they may not need such heavy sedation.
They started weaning her off the pain meds so she would start coming around.
They told us it would be 24 hours and you would start seeing her start waking up.
The hospital had a policy where they expected us to only have one parent in the room, but we never left.
We talked to her, held her hand. You're thinking that, is she going to wake up? Is there going to be some type of issue and there's not going to be brain waves?
You want to be sure that they wake up in a timely manner, and you also want to make sure that you can assess them neurologically.
Just waiting, watching the machines, listening to the beeps and the numbers, and looking for any type of response.
They kept saying, oh, any minute now she'll wake up. She didn't.
Welcome back to Something's Killing Me. Lindsay Meier and Kevin Nesbitt were healthy young adults who complained of a sore throat and low-grade fever. Just days later, each went into septic shock and wound up in critical condition. Now, they are fighting for their lives. Will doctors discover what's killing these young people before it's too late?
He was admitted to the intensive care unit, and this is where I got involved in his case the next day.
At this point, doctors had already ruled out the more common causes of fever and sore throat, such as strep throat, mono, and pneumonia, so they had to look elsewhere.
Dr. Almertada noticed that Kevin's jugular vein was swelling, and so I think that was how they leaned towards diagnosis.
When someone is presenting with a sore throat, with a pocket of infection in their lung, then now it's spreading to other organs. You really have to have a high index of suspicion.
I was most shocked when we finally got a firm answer.
I'd never heard of it before.
This potentially fatal disease affecting otherwise healthy people is called Lemierre syndrome.
Lemierre's was a very well-known complication of sore throats in the early part of the 20th century. The classic article was written by Lemierre that described the syndrome. There were a lot of case reports.
Lemierre's is a rare complication of sore throat in which the bug seems to travel from the throat and can set up in the internal jugular vein as an infection, like a clot. And from there, that infection in the vein can actually wind up breaking off and showering other parts of the body. So infections that have spread elsewhere. And the most common place that happens is to the lung.
This can be confirmed by the culture results and imaging studies, such as a CAT scan or an ultrasound of the neck or the chest. Then we tested for that and we started him on treatment.
This is a very rapidly moving infection. It's really hard to eradicate, and it really takes people downhill very, very rapidly.
Most of the time, a diagnosis is a blessing. With Lemierre's, because it's so rare, that path is like walking through the dark woods without a flashlight. You don't know what's next. There's no guarantees.
If it's that rare, is there a magic drug out there? Chances are a drug's not been developed potentially to fight it. You don't know for sure.
And they kept saying, oh, any minute now she'll wake up. She didn't.
Unfortunately, not every patient can tolerate waking up, and sometimes you do get into trouble with some accumulation of these medications.
We just needed to see her eyes. We needed to squeeze her hand. We needed to make contact with her.
Her blood cultures came back, and it was identified thereafter as Fusobacterium necroforums.
And Fusobacterium necroforum is the bacteria that most commonly causes Lemierre syndrome.
We had no idea what that syndrome was and what it entailed. When you go online, you see a lot of the cases that the patients don't survive. They don't wake up.
Properly diagnosing Lemierre syndrome is only the beginning. It helps doctors initiate treatment, but that diagnosis doesn't guarantee a full recovery or even survival.
It took a little personal research to understand what Lemierre's was and how serious it could become. I found a site by a family, Justin Rogers, and they've kind of become the spokespeople for this particular syndrome. And I got a lot of information from their site, and I think at that minute, I suddenly realized we were in danger.
Justin Rogers' family is using his story to really help others.
Justin was 17 and a junior in high school when he became ill. He said it was the worst sore throat of his life. And so my mom took him to the doctor, and they diagnosed him with strep. and they gave him steroids and antibiotics, and he didn't get better.
He kept on saying, this is not like a strep throat. I've had a strep throat. Sore throats get better with or without antibiotics in 3 to 5 days. If they're not getting better, you have them on the wrong antibiotic.
He was sleeping all the time. His eyes were, turning super black underneath and just real lethargic and real sick. And I told my mom, you probably should get him to the hospital. So they did. And then that's when they found out his kidneys were failing, like his whole body was just shutting down.
Justin spent 3 weeks in the ICU before doctors even had a diagnosis of Lemierre syndrome.
As horrible of a disease as this was, when my family found out Justin had Lemierre's, it was like, we know, we can fix it. If you're given the correct medication right away, you can come out okay. Timing is everything.
Ironically, for a disease that few people have heard of that's actually really difficult to diagnose, the cure is something that all of us have heard of.
The Fusobacterium, the bug that causes Lemierre's, is almost always susceptible to penicillin. So good old penicillin. Going back, penicillin would prevent Lemierre's syndrome.
Before the use of antibiotics, a case of Lemierre's disease would kill almost 90% of affected patients. And then after widespread antibiotic use, it became so rare, it became known as the forgotten disease. Even today, a lot of physicians have never seen a case, but an undiagnosed case can be absolutely deadly.
We never, ever, ever thought Justin would die. And he passed away on my wedding anniversary.
He was on the right antibiotics, but it was too late. Penicillin started being used in the 1950s and 1960s. Virtually every kid who had a sore throat got a shot of penicillin. And then in the 70s and 80s, we started being more restrictive in who we gave penicillin to.
All the research I've done, I really, truly believe with all of my heart, this is making a comeback because we stopped prescribing penicillin for everything.
While Lemierre syndrome is rare, there has been a recent increase in reported cases in the past few years. And we're not sure if this is because we have better screening and more diagnosis, or because there's an actual increase in the amount of infections.
Estimated in the 15-year-old to 30-year-old age group that approximately 14 out of 1 million people, or 1 in 70,000, would get this each year.
In general, even though Lemierre syndrome can affect any age group, it's more common in healthier, younger adults.
I have no idea why it attacks young, healthy people. Some of these patients come in very sick, septic, and either the patient is unconscious or they're so sick that they can't answer questions. And if you don't get the history of the sore throat first and you don't notice the swollen neck vein, you might not put the story together.
Because of how difficult it is to first suspect and then diagnose Lemierre syndrome, it's possible that there have been many unreported cases, and patients have actually died without doctors ever knowing what the cause of their infection was.
We have this phrase in medicine that, like, I've never seen Lemierre's, but maybe it's seen me.
They still needed to go in and drain the material that was in his lungs.
The scariest point was, what's gonna happen if we can't get this out?
Two healthy, athletic young people have been diagnosed with the same illness, Lemierre's syndrome, a dangerous bacterial infection thought to have been nearly wiped out in the early 20th century. But now it's back with potentially fatal consequences, and doctors are struggling to keep their patients alive.
If you think about how common a sore throat is, by some estimates, 6% of adolescents get seen in a doctor's office for a sore throat every year. So no wonder it's not recognized as quickly as we might hope. You could miss when things take a turn for the worse.
Lemierre's is life-threatening once it leaves the neck. So when those little clots go off and it gets into the lungs and now it's in the blood and it's causing this overwhelming infection, if we don't get the right antibiotics, you're in serious, serious trouble.
We've learned a lot of really important things about Fusobacterium necrophorum, the bacteria most commonly responsible for Lemierre syndrome. We don't suspect it's contagious, and we actually do know where it lives.
The bug that causes Lemierre is Fusobacterium. I have it in my body right now. It's in our mouths, it's in our GI tract. It's there all the time, usually causing no problem whatsoever. Nobody's been able to really determine a rhyme or reason why some people have this bacteria that's just kind of hanging around all of our bodies becomes a catastrophic infection.
We don't know what's different about them. Did they get a virus first that allowed the infection to take place? We have no clues. Doctors test for strep, test for mono, and give them a Z-Pack, maybe some steroids. And that's really bad. We know from a lot of different studies that this bacteria is not going to respond to Z-Pack. This bacteria is going to respond to penicillin. Never give azithromycin, which is a Z-Pack, because it doesn't cover this bacteria.
Early diagnosis is key in treating Lemierre syndrome. It's the difference between life and death. Unfortunately, there is no really quick test to find the disease. And so while doctors are waiting for a culture, they still need to race to save the patient's life.
For Kevin Nesbitt, Lemierre syndrome led to the formation of bacteria and fluid-filled pockets in his lungs, where the antibiotics can't reach. These are abscesses. To clear the infection requires surgery, and for a patient already compromised, it can be fatal.
They ended up scheduling the surgery right away to break up the abscess and try and get it drained out and put a drainage tube in. The process to do that is not very pleasant. They don't put you under. There's very little numbing that goes along with it, so you're pretty much aware of the whole surgery.
They had extracted about 2/3 of the fluid in his lungs, and they had to stop because he was coughing and spasming so hard that they couldn't take any more out. He went fully tachycardic, which just means that his heart rate was extremely elevated, and that can cause a stroke, it can cause a heart attack.
You don't want to see somebody you care about in pain like that, and that was definitely hard for me to see my brother like that.
So when we got moved back up to the critical care ward, he was much more cognizant of the fact that there's now a large amount of fluid on his lungs, and the pain is increasing. And they still needed to go in and drain the material that was in his lungs.
I think that was probably, for everybody involved, was the scariest point, was like, okay, what's gonna happen if we can't get this out? And how fast this stuff escalates.
I also knew that Kev was fighting. He was fighting for his life.
I remember the doctors being out in the hallway, and I ran out there and was like, she's coming to, she's coming to.
I was out of the room taking a phone call when she woke up.
She was still intubated, so there was no way that she could speak with us. Sign language was the only way she could communicate with us.
She signed, "Where's Daddy?" Her syndrome attacks both lungs at one time, where pneumonia attacks one lung and then usually attacks the other. So it's a more gradual process, where hers is more of a fast onset.
The bacteria ended up filling up her lungs with fluid in her pleural space. So they had to go in and clean all of that out.
A minimally invasive procedure called a VATS, or a video-assisted thoracoscopic surgical technique, where he was able to go in and clean out that infected fluid and those infected areas of the lung.
So they cleaned out one side and then came back the next week and told us that they were going to do the other.
It was hell. It was miserable.
Those were the hardest days of my life.
There were huge clots. This was getting pretty serious.
After being diagnosed with a very rare and potentially fatal disease called Lemierre's syndrome, both Kevin Nesbitt and Lindsay Meier were fighting to survive. Doctors had a diagnosis and a potential cure in penicillin, but with their lungs and other organs already failing, would it be enough to save these once vibrant young people? Then finally, a sign of hope.
She was tough. She's daddy's little girl.
Her organ system failure started to get better. Her signs of severe sepsis started to get better. That's when we started to suspect that there was likelihood that she was going to survive this.
She was amazing, amazing. I think I saw her get upset one time. She's the strongest girl I know. I couldn't be more proud of her and how she handled that. 31 days, not knowing what's going on, and surgery after surgery, chest tube after chest tube. Never saw her complain, always in good spirits.
She was willing to do whatever she had to do to get out of the hospital. She was a fighter.
And I was like, oh, I'm getting better. I was happy about it. I could have died, and I wouldn't have even known it. I would have just fallen asleep and never waken up again.
When they were releasing her, she had to put on clothes. And I think that was the first time that I really realized like how much weight she had lost and just how frail she looked. You know, it was hard for her to move around, too much movement, and she would lose her breath.
That was kind of a moment where I was like, oh, you got a long ways to go before you're better, where you're 100%.
I honestly believe going to New York City saved her life.
I could have stayed home instead of going to New York for spring break. I could have not ended up in Lenox Hill. And that's just where I needed to be, was with the doctors that knew what I had.
If she hadn't gotten on the plane, I don't know if the outcome would have been the same. So I'm very thankful that she was on that trip.
At Metro Health Center, Kevin Nesbitt's condition worsened. 2 attempts to surgically drain the fluid from his lungs had failed.
This was getting pretty serious. I think that at that point, they decided that they just needed to do whatever they needed to do to get the lungs drained.
The third surgery, they finally put him under, and they just went for it.
They extracted 2 liters of fluid in 9 hours. There were huge clots that would come through the drainage tube. That meant that he'd be able to breathe again.
Next thing that I recalled was waking up in the ICU, alive and functioning. Still a little loopy from things, but was coming to the terms of understanding what exactly I had just gone through. And content, realizing that I was gonna be okay.
It was actually kind of a cool moment when all of that started to heal up and he started to improve. I mean, he'd lost so much weight through the whole process, and you could just see the color coming back to him.
They started giving him goals. So within the next day, he was sitting in a chair. From the point of the chest tube finally being placed, then everything was about getting out and getting healed and going home.
When it all came down to the end and we were seeing progress, and I was waiting just day by day to hear those words, it's time to go home. And it finally happened, and best day of my life.
I definitely think it's important to get awareness out about Lemierre syndrome. It looks like the flu. You could think that you're just having a normal run-of-the-mill cold, and then all of a sudden your life is flipped upside down and you're in the hospital, and if you don't catch it quick enough, you might die.
It still has a fatality rate of about 5%. Now, when you're talking about otherwise healthy 15 to 30-year-olds, that is obscene. 5%, that is a horrible, horrible thing.
I think about how many people you hear dying from pneumonia, and then you wonder if it just wasn't misdiagnosed.
At this point, awareness is one of our best tools in educating the public about Lemierre syndrome and helping doctors think about this diagnosis in any patient with complicated pharyngitis. The right diagnosis can help a patient get the right treatment at the right time.
It is absolutely amazing the people that have told me Justin saved our life. We found out because of you and your nonprofit. And all I have for our website is just the symptoms, how it can be treated, just simple things that I wanted to know while Justin was sick.
When I see a college student die of Lemierre's, and I know that it's a treatable disease and a preventable disease, it just tears out a piece of my heart. It just shouldn't happen. And we've got to figure out a way to be smarter and prevent this.
It's a story that I tell on a regular basis now. I try to keep it as a point of strength versus a point of vulnerability.
I just ended up to be a very, very lucky girl.
Lindsay and Kevin made it out with their lives, but the road to recovery would be long. We're happy to report that they are now completely healthy. 89% of Lemierre's patients are between 10 and 35 years old, with a sore throat that typically precedes other symptoms by 4 or 5 days. Because early diagnosis is key, Justin Rogers' family continues their mission to spread awareness in the hopes that their tragedy is never repeated again. Thanks for joining us. Good night.